recorded for the purpose of colleagues who were unable to attend today. Can I have the next slide, please, Jade? Thank you. So in terms of housekeeping, if I could just ask participants to keep their microphones off unless they're speaking, and we invite you to use the chat function throughout the session, as well as using the interactive discussion session. It would also be great if colleagues could introduce themselves and the organisation that they represent in the chat whilst we are waiting and we get started on the introduction. Members of our team will be monitoring the chat and responding throughout, and themes can be discussed during our interactive session. If you use Twitter, then we invite you to use this and tweet about our event. And there's a link here on this slide for those colleagues who are not members of the Child Health and Wellbeing Network and who may wish to be so. And this obviously can be shared widely across your networks. We will share these slides for colleagues to look at in more detail. And if I could just ask you to move on, Jade. Thank you. So we're really pleased to welcome the colleagues to the event today. And as usual, our Huddle programme includes a broad church of participants. We have education, further education and research partners present here today, as well as local authority colleagues from across our geography, as well as clinical and non-clinical health colleagues from the ICB and provider trusts. We're also lucky to have representation from the voluntary community sector and also public health representatives. Next slide, please, Jade. So a brief introduction about the network for colleagues, recognising that time is short. For those of you who don't know me, my name is Louise Dauncey and I'm a Network Delivery Manager for the Child Health and Wellbeing Network. My main role and responsibility is around the Children and Young Persons Transformation Programme. Just wanted to take a few moments of your time to give you a bit of background about the evolution of the network, the context in which we work, and some of our programmes of work. Next slide, please, Jade. So this is our vision, and our role is that of cohesion, and ultimately our aim is about connecting different parts of the system to share good practice and drive improvement. This is ultimately the mandate that we've been given by the system-wide engagement that we undertook as part of consultation in 2018 and 2019. Next slide, please, Jade. Just to provide the context then for our work and our local demography, recognising the high levels of socioeconomic challenge. The North East and North Cumbria is the largest ICS in England, and we operate across a large geography with a diverse population. Within this, we've got a large number of GP practices, 13 local education authorities, 8 acute trusts, 3 mental health trusts and 3 ambulance services, and in excess of 1,200 education settings. The visual in the corner on the left demonstrates the levels of deprivation, and you can see that the public health fingertips information marked in red indicates where we perform less well than the national average and that we have high levels of deprivation. Next slide, please, Jade. I won't dwell on this slide, but the graph on the left-hand side here highlights this challenge, and you will see that the number of children and young people living in relative poverty in the North East and North Cumbria is steadily increasing. And for the first time in 2021, it overtook London in being the region with the highest rate of children living in poverty. The research that we have suggests that 38% of children and young people in the North East live in poverty, which in terms of a representation is approximately 11 children in an average class of 30. Next slide, please, Jade. We're all aware of the importance of the early years in terms of growth and development and the impact deprivation has on this. There's an interesting report that's been written by the Institute of Health Equity and colleagues may wish to view at their leisure. And this has influenced our direction of work. Next slide, please. So in terms of evolution of the network, we undertook engagement activities as far back as 2018 and 2019. There were over 1,000 points of contact from colleagues and individuals across the system, including education, health, social care, public health, voluntary community sector, and also children, young people and their families. And we now have a membership of about 1,700 individuals and an ever-increasing fellowship on Twitter. Ultimately, our mandate from this engagement was to connect, share good practice and drive improvement. Next slide, please. So the engagement activities that we undertook has supported us to identify 9 priorities, which holds children and young people at the centre of all we do. These areas will not be a surprise to participants, recognising our demography and socioeconomic challenge, and obviously the diversity of our population. And poverty and deprivation is a huge part of this. Next slide, please. I'm just going to skip over that slide, but that just provides some population information for our area. Next slide, please. In relation to our ever-growing membership, this slide demonstrates the makeup in terms of the various parts of the system. And over the recent years, we have seen an increase in all sectors, which you can see here on with the pie chart that's demonstrated there. Next slide, please. So I won't spend much time on this slide, but this just gives a flavour of the various projects and programmes we've undertaken or currently is in progress, and demonstrates the various mechanisms and partnerships we have in place to progress this and embed these connections and share good practice. Next slide, please. As mentioned earlier, we have some significant challenges in our area and have some helpful evidence and baselining information, which can be found in our North East and North Cumbria Facts of Life documents, which is available on our Healthier Together website. Next slide, please. Information is available about one of our particular programmes relating to respiratory illness. This was a piece of collaborative work to identify available resources for professionals and for individuals. And again, information is hosted on Healthier Together, and the slides will be shared with the links on. Next slide, please. So another area of our responsibility is in respect to the children and young persons transformation agenda. This is largely about the integration of services, improving the quality of care and experience for children and their families, and also the inclusion of young people more readily in the development of service improvement programmes. And there are a number of areas of work that are highlighted there on the slide. Next slide, please. Just to leave you with a quote by Sir Al Ainsley Green, which summarises our ethos and the commitment of the network to work together across the system to advocate for children and young people. Essentially, this has become our purpose. Next slide, please. So without further ado, I will hand you over to our chair for today, Adele Pearson. Adele is our newly appointed Child Health and Wellbeing Network System Leader for Education. She joins us from Ascent Academies, where she's the executive head of one of our special educational needs settings in our footprint area. Adele comes with a wealth of experience in relation to special educational needs and additional needs, and is passionate about cross-sector collaboration to improve outcomes for our children and young people. Many thanks, and over to you, Adele.
Thank you, Louise, and welcome, colleagues. What a diverse group of colleagues we've got. I've just been looking through the chat, and it's really, really positive to see the range of organisations represented. And I think for me, just that cross-sector representation, which is obviously part of what our network is about. I know Heather has put in the chat, if people haven't already joined the network, please feel free to do so. Absolutely fantastic network of such a range of other organisations joining together. So today we're going to hear from Steve and his team in terms of research, cross-sector research, and how we can get educational settings more involved in research. So I think without further ado, I'm going to hand over to Steve, who I'm sure will introduce himself, and I know he's got colleagues on the call as well who are going to be inputting. So welcome, Steve, and thank you for joining us today.
Thank you, Adele, and good afternoon, everybody. Thanks for joining us on this rather warm afternoon. I'm going to start just by telling you a little bit about the role of the National Institute for Health Research and the Clinical Research Network in particular. I'll run through some of the background to the work that we're already doing, supporting the delivery of research in education settings across the North East and North Cumbria, and Kate will join us partway through the presentation to talk about her role and experience in supporting some of this work, and then we'll give you a summary and an explanation of some of the support offerings that are available directly to enable people working in and children in those organisations to take part in research across the region. So we'll explain exactly how and where and when you can go to get the support and advice you need to help you engage and deliver research that we're all working to deliver for the children of the of the North East and North Cumbria. Can I have the next slide, please, Jed? And I'm really pleased to see that, as Adela said, the diverse group of people that we've got. I can spot some familiar names in there and some new names. So I'm really pleased that we've got a good cross section of different people representing various parts of the system across the region. Some people may or may not be familiar with the role of the National Institute for Health and Care Research. The Clinical Research Network is one part of the big NIHR family that enables and supports the delivery of research for patients and the public. And the aim of what we do ultimately is to drive forward improvements in care and advance knowledge that benefits the people of the North East and North Cumbria and across the whole of the country as a national organisation. The main role of the research network, fundamentally, we support the costs that allow people to deliver research across all health and care settings. And we provide the resources that enable those people to undertake the research that's fully funded. And we provide access to the study support service, which we'll talk a little bit more about in a couple of minutes, that enables people to plan the type of research that can be effectively delivered across a range of organisations in both NHS and in non-NHS settings. And our remit is extremely broad and covers the whole of the health and care system across the country. Can I move to the next slide, please, Jed? And I thought it would be really helpful just to reference the really important link between the work that we do in health and care and the work that takes place in educational settings, and how the work that we all do is ultimately potentially driving standards up and improving the health and wellbeing outcomes and reducing health inequalities for the children and young people in the region. And I think there's an important parallel there to recognise at this point that by delivering research and improving access to health and care services, we can have a direct impact on the outcomes and improve the quality of life of the children and young people and the families that live within the region. And research is a really important way in which we can push those standards and lead to improvements that are then embedded in the work that we do. And the area that we're really keen to hear more from people on the call later on this afternoon is about the ways in which those people working in education are able to help us and work together with us, and we can work with you to push this agenda forward. And we'll provide some examples of the things that we're already doing in terms of research in schools and engaging with children and young people. And there are links embedded throughout this presentation that you'll be able to access at your leisure once we've finished the Huddle this afternoon. People can come back to us if they have any questions about some of the further detail. The next slide, please, Jed. And I think extremely important to reference the really valuable role and the critical involvement that we take in terms of involving children and young people and taking their views into account, and the co-development of the research that we deliver that meets the needs of the children and young people. So it's a fundamental aspect of what we do in health and care research. We're really fortunate to have an extremely vibrant young persons advisory group that supports and evaluates and recommends and has input directly into the development of studies that are being developed and delivered in the North East and North Cumbria. And for those people that take part in our research studies, we have an experience survey, so anyone taking part in an NIHR study can provide direct feedback about their experiences of taking part, and that helps us shape the work that we deliver. Jade, I wonder if we can try to play the video that's embedded on this slide.
Hi, my name is Izzy.
And I'm Alex.
And we're here today to talk to you about health and care research. This research is really important because it can help us understand more about ourselves and improve the quality of care for people all across the world. Young people don't often get chances to take part in this kind of research, and it's really important that we do because we have current perspectives and experiences which can be really valuable to researchers. And when we're involved with this kind of research, it helps ensure that results are tailored to our needs.
There are many ways young people can take part in research. For example, you can volunteer to participate in studies, or you can share experience with researchers, often via surveys. If you're interested in getting involved, speak to the National Institute for Health and Research. Scan this QR code to do so.
Thanks, Jade. So that was a short snippet of some of the young people that are working with us. Yes, thanks, Jade. We'll talk a little bit more about the role of the Young Persons Advisory Group a little bit later on in the presentation this afternoon. But I think really important just to reference the fact that everything we do is shaped by and informed by the views of children and young people, as well as those that are working and helping deliver research for those people. Move on to the next slide, please, Jed. You might need to press a couple of times to skip through the embedded video, I think. There we go, thank you. So as I've already alluded to, a significant amount of research is already taking place across the health and care system in the North East and North Cumbria and across the whole country. Since 2019, more than 7,000 children and young people have taken part in NIHR portfolio studies across the North East and North Cumbria, to 120 individual studies across a range of settings in the region. So we already have a really good basis for an experience in supporting the delivery of research with children and young people. From a school perspective, in the last financial year, approaching 5,000 children participated in research studies across England based in schools, and more than 200 schools took direct involvement in research studies. So there's already a significant amount of work taking place across the country. And over the last 5 years, more than 60,000 children and young people have taken part in schools-based health and care research across the country. And a significant proportion of those participants took place during the COVID-19 pandemic, and there was a significant amount of research involving children and young people as part of the urgent public health research that we supported across the country. And I just want to highlight a couple of particular studies that we're delivering and have delivered over the last 12 months, either through schools or local authorities. And we'll tell you a bit of a story about a particular study that we've worked really hard to help deliver in collaboration with schools, a study called Map Me, which we'll talk about in a couple of minutes. But really just to give you a flavour of the scale and scope of the work that's taking place both at a local and a national level, involving children and young people across education settings. Next slide, please, Jade. So as part of our ever ongoing desire to improve the way in which we work, we were really keen to not just recognise that we're already delivering research, but start to think about how we might open up more opportunities to engage with and deliver research in education settings across the region. So over the last 12 to 18 months, we've worked closely with the Child Health and Wellbeing Network to get a better understanding of the key drivers for and barriers and challenges that might enable us to deliver more research within school settings in the future. And we'll talk for a couple of minutes about the work that we've just completed and shared a report recently, which we'll come back to as we work through the presentation. Next slide, please. So as I've said, we were really keen to get a better understanding directly from those people working in education settings about what might be needed to help us deliver research more effectively. We've really only touched the tip of the iceberg in terms of potential access to and delivery of research in schools in the region. So we thought the best way to get a better understanding of how and where we should engage more effectively with schools was by seeking that direct feedback. So we developed a survey with the input of education advisors that were funded through some of the NIHR money that we put towards this project. And we were really interested to hear about the views from those people working in education about how we can better engage with them. What are the barriers and challenges to delivering research in schools? What are the priorities for those people and for the well-being priorities that have been set out through the Child Health and Wellbeing Network that Louise talked about a little bit earlier on. So we pulled some of those threads together and we shared a survey quite widely over the last year. We received 68 responses from senior school leaders across the region, and we'll talk a bit about some of the findings of that work in a minute or two, but I'll hand you over to Kate, who has helped support this work in a really important way, and Kate will talk a bit about her experiences of supporting this work from an education perspective. So on to the next slide, please, Jade, and over to you, Kate.
Thanks so much for having me. It's so lovely to see the fruits of the produce of everything that we did throughout the course of the last 12 months come together in this webinar this evening. So basically, it's probably worth talking about what our starting point was. And so I was a full-time deputy head last year, seconded to the Child Health and Wellbeing Network for a day a week, and had the fortunate position of being able to work with NIHR. And one of the things that I approached Steve and John with was a bit of a request. I said, do you have any studies that you have which can help support research practice within schools? And said, yes, you know, we're working on a couple of really good studies at the moment. We've got the C-Billet study and we've got the Combat study. So right, we must get all of this information out to schools, because it was fascinating to find out and to understand what the process was to get a research study to that point, but also for research to have an impact then on a child or young person's life, and ultimately have great outcomes for them as they continue their educational career. So that was really the starting point. And one of the things that we wanted to do was to say, well, we've got these research studies, how can we get even more research studies into schools, but also how can schools help to drive this forward? So we were pretty much aware that research is often done to educational settings. It's not often that educational settings have that opportunity to help carve or shape a research study. But also we know that the improvements that people might want to see in their specialist assessments, so for instance, speech and language, they might, want to see enhanced standardized scores. We also want to see those benefits in education too. So that kind of just gives you a bit of a background to the summary of the survey that we produced and why we wanted to produce it. So if you just move on to the next slide, please, that'd be great, Jade. Thanks. So when we developed the survey, we really wanted a cross-sector approach. So we worked NHS, NIHR, Child Health and Wellbeing Network and Education to design a survey that could go out to senior leaders to say, what is it that you feel really needs to be the driver if we are looking to try and improve research outcomes and children and young people's perceptions of research? So we know that children spend 6.5 hours a day in school, and we know that they can make massive strides of progress. So we wanted to try and get as many educational settings to work with us to say, right, come on, you help us to shape what our recommendations need to be. So at this point, the questions focused on a variety of areas. We talked about the background of research, what were the biggest barriers. So we talked about how we attract health and care research studies into schools. We talked about ethics and governance and how important that was. And basically, do educational settings understand how to set up a study or who to approach? And were educational settings aware of the resources that NIHR and the Clinical Research Network could provide? So the results were really quite telling. But also, in addition to this, because of the collaboration aspect of it, we also wanted to find out the vulnerabilities that children and young people were facing across the board, and how teachers and educational professionals were experiencing difficulties, possibly as a result of the pandemic, or even just because of society developments. We wanted to really unpick and understand what some of those difficulties were. So the questionnaire that we developed was twofold, to really understand how we get into research, but also then to think, well, how can we then use research to help improve outcomes? If we just move on to the next slide, Jade. Thanks. We also had a bit of a slightly different slant and hidden agenda, because one of the things that we really wanted to do, we're all here collaboratively tonight representing our respective professions. But one of the things that was really interesting was about the number of healthcare student placements that are in shortage, but also that could operate in an educational setting. So Health Education England also wanted a little bit of a taken into our survey. So they were talking about reciprocal placements. You know, we talked about spending time on placements in education settings and in secondary care settings. And it was just to get a flavour of how people are viewing this collaboration between NHS, NIHR and education settings going forward. Because I think what we can appreciate is that together we are much stronger than working individually in our respective professions. And not to say that we're all trying to become experts in everybody else's field, because we're absolutely not. We're just trying to use each other to help further our own developments and needs. So hopefully it gives you a bit of a background flavour as to how we developed the survey and why we developed it. But basically the ultimate aim was to improve children and young people's outcomes across the board. So I think I'm going to hand back to Steve now, just to give you a bit of a background summary for the outcomes and recommendations of our research.
Thanks, Kate. Jade, if you can just move on to the next slide, please. So the survey that we circulated and had a fantastic response from, we undertook a period of time to review and understand the responses we received, and we were really grateful to the support from Dave McPartland, I think maybe on the call this afternoon, and Amelia Salisbury as well, who supported the development of the recommendations that you see presented on this slide. There is a link to the full version of the report and a QR code embedded if people want to access the full report. But some of the key findings which we've already started to implement within our operational procedures were really valuable lessons for us to think about, particularly in terms of how we engage with and share information and the type of information and who we share that with within education settings. The NIHR traditionally has been more focused around delivery of research in health settings, working in the NHS, and the way in which we engage around clinical trials is very different to the way in which we need to share information for people working in education. And we need to be really clear about the way in which we share information and how we explain and include information around the benefits of delivering research from a more holistic perspective, and how those research studies can help benefit children and young people and those working in education in a more rounded way. So any research that we deliver, we know has a beneficial outcome in terms of the work that we're delivering, and the experiences of those people taking part are listened to, and we know that there's a significant benefit for those people that take part in research from the responses that we receive from the experience survey. And we need to make sure that we're building that in a virtuous cycle of learning and listening as to the responses that we receive when we share studies in the future. And we also need to make sure the research that we deliver fits the needs of those children and young people and those people working in education. So the priorities that Louise referred to earlier in the presentation around mental health and poverty and additional needs and vulnerability, we need to make sure the research opportunities that we provide sit within those areas of most need, and that we deliver research that is necessary and required for the children and young people, and that meets the needs and challenges that they face. So we're developing our work streams off the back of the survey. There's a whole raft of work that we're aiming to deliver, which I will talk a little bit more about at the end of the presentation in 5 or 10 minutes time, which will lead us into a conversation about how we can take some of these areas of work forward and actually put this into practice, and make sure that in the future, when we have opportunities to deliver and develop research in collaboration with those working in education and the children and young people, that we do that in an effective manner, and that we build into the work that we do the recommendations that are outlined in the report. Can we move on to the next slide, please, Jade? So I'll hand you over to Alex Ramshaw. Alex, I think are you on? Is Alex on the call?
Yes, I'm here, Steve.
Yeah, hi, Alex. Alex works for as one of my colleagues in the research network, and she's one of the direct delivery team leads. And Alex will talk to you a bit about the practical supports available to help deliver research, and provide an example of a specific study in which the direct delivery team have worked with schools to deliver a study over the last 12 months. So over to you, Alex.
Thanks, Steve. Jade, can I have the next slide, please? So my team is the direct delivery team, or agile research team as we're sometimes known, and we were funded by the Department of Health back in 2021, and every clinical research network in the country has a direct delivery team. We have a team in Cumbria and also in the Northeast, and this enables us to deliver research in multiple settings across the whole region. So our initial DDT aim was for a new workforce with the flexibility, capability and capacity to deliver priority research studies across broader settings. So again, we all know that there's a lot of research done in secondary care settings and primary care settings, and we aim to bridge that gap in between for all those other areas. So our Department of Health funding allowed us to provide 11 staff members to deliver research in settings. We have provided funding to staff members embedded in local authorities, as well as the network to promote research. And we have 9 social care experts within the region. Our research budget from the Department of Health has also covered staff in the patient and public involvement and engagement team, which we work closely with. So our delivery team consists of mixed clinical and non-clinical staff with skills and backgrounds in various sectors. We can provide support in multiple areas, as you can see on our little map there. And currently to date, we have managed to offer support in secondary care teams when they've been short-staffed and we've got capacity. We've supported primary care settings with multiple studies, and we've taken on our own primary care studies that are for underserved communities. We've also provided research in the education system and local authorities. So we provide additional expertise and resources to complement existing research teams. We can bridge the gap between NHS and community-based research. We facilitate research in a variety of settings, including social care and education settings, and we respond to the health needs of local people and proactively work with underserved communities. Can I have the next slide, please, Jade? So one of the studies that we've supported delivery with is the MAP-Me2 study. So that's looking at, can embedding the MAP-Me intervention, a tool to improve parental acknowledgement and understanding of childhood overweight and obesity in the National Child Measurement Programme, lead to improved child weight outcomes at 1 year? So a number of local authorities were involved in this study, and parents were sent information about this study alongside standard NCMP information. Parents could then choose to opt out of this study. The local authority would be randomised to receive the MAP-Me intervention or standard NCMP service. So all children in UK are measured for NCMP in reception and year 6, and those that took part in the MAP-Me2 programme would be measured in year 1 and year 7 by school nursing teams. Can you pop the next slide on, please, Jade? So our direct delivery team were approached by South Tyneside Local Authority originally, and that was in early 2022. And this was a request to support their school nursing team, as they simply didn't have the capacity to take on the extra measurements for the year 1 and year 7 children for MAP-Me2. We were given a great opportunity to shadow the school nursing team for their NCMP measurements, so we were able to learn how to correctly measure all the children, and we were given equipment so that we could carry out this job. We were able to weigh a number of children in secondary schools in November 2022. And again, at the end of 22, we were asked to support Newcastle Local Authority, who also had the same issue with their school nursing team capacity. So by January 2023, we began to measure children for both of the local authorities. In terms of support, our team were able to contact all of the schools. We sent out letters to be given to parents to remind them of the study that was happening, and we coordinated all delivery staff and additional staff that supported us from the study team. We were able to book over 90 visits in total, and we kept all teams up to date, so from the local authority team, the study team, and all of the schools that we were working with, so that they were aware of everything that was happening with the study. So far to date, the direct delivery team have completed more than 7,000 measurements for the 2 local authorities, and we've been in over 130 schools. We've even been able to do follow-up visits to catch any children that we missed on initial visits, and that's one of the main studies that we've worked in schools. There's obviously other research going on in schools, especially for mental health, such as Combat, as mentioned, PIPA and Artemis, and these are all studies that our delivery team can support. Obviously, if anyone wishes to request some support from us, I will pop our email in the chat as well. And again, we're more than happy to take any general queries about delivering research in education settings. Thank you, Jade. That's me done. On to the next slide.
Thanks, Alex. Our next speaker is Becky Russell, who works as part of our team within the research network and works closely with Alex and her team.
Thanks,
and she will
Steve.
talk about some of the practical support that's available to help set up and deliver studies. Over to you, Becky.
Thanks. So the next few slides aim to provide a brief overview of the support that is available from the Clinical Research Network, either as a school interested in getting involved in research or as a researcher from developing a study idea all the way through to completion. Next slide, please, Jade. Thank you. The team I work with is made up of research operation coordinators and officers. We support and facilitate the setup of studies across the North East and North Cumbria. This covers primary care, secondary care and outside of NHS settings, which includes schools. We can help support schools to get involved with research by using our expressions of interest service, which means sending information on research opportunities available to schools. For example, when study teams contact us looking for schools or sites to take part, we will review the study and break down what is required for the school to take part. Next steps is to then circulate the study for interest using our schools, local authority contacts, including our local authority research operation officers, who are currently based in Cumberland and Furness, Gateshead, South Tyneside, Millsborough and Redcar councils. Where possible, when we circulate any study, we will also include additional study documents. This could be the consent form or further information on the study process. It's vital that the school has as much information as possible to review before they decide if they want to take part in the study. Once a school has agreed to take part, we then start our set-up coordination process, which includes cost and assessments. This is where in some cases schools can be reimbursed for all the research related activities they take part in. Localising and supporting with file setup. If any documentation needs localising, we can complete that for you. In most cases, study teams will also send out site files where all information regarding the study will be kept in a local files, which will be held at the site. This can either be physical file or electronic. Make sure relevant documents are in place by completing any data sharing agreements between the school and the study team, or any finance contracts that are required to receive any payments. And also, as Kate mentioned earlier, make sure all governance and ethic approvals are in place. We act as the point of contact between sponsors, study teams and any sites taking part. And we can advise on any necessary training requirements and direct you to our NIHR Learn site, which offers a range of training and learning materials, which is free to access. Next slide, please. The best way to get the most from the study support service and access our full range of support, particularly if you are new to research, is to get in touch with us within the early stages of your research project. You can do this by booking an initial meeting with one of our research operations managers who can describe and advise the research landscape for you. Example of areas we can support you at an early stage include advice about delivering your study, including signposting towards key partners and stakeholders who can help drive forward. For example, the study design service, who can help with any protocol development and help identify appropriate funding streams and work with you to develop grant applications. We provide local intelligence about sites and services within our region. This helps to optimise delivery and plan recruitment pathways. We do so by sharing information about your study with expert colleagues. This enables the researcher to receive vital feedback on any potential challenges and the feasibility of your study being delivered across all sites. From a performance point of view, we keep all your research studies on track by continuously monitoring the study during its duration. Our systems provide unique access to study-wide recruitment data. When combined with the study review schedule, it enables a proactive approach by identifying and supporting struggling studies. If a study is struggling, we can undertake a performance review and, if necessary, develop an action plan that can be implemented, more often than not involving Alex's team to help with the delivery. So that was just a very quick whistle-stop tour of our main functions of the roles within the service. But if you'd like further information or would like to meet up face-to-face or virtually, please get in touch and we'll be happy to share all our contact information after this event. Thank you.
Thanks, Becky. Jade, can you move to the next slide? I'd like to now introduce John Rouse, who's Project Manager and Wellbeing Lead for the Research Network. He's going to talk to you about the Children and Young People survey that's been developed. Over to you, John.
Thanks, Dave, and lovely to see so many people here. That's absolutely brilliant. I won't take long over this. Over the past 18 months, we've been looking to work out how we best get research information out to the people who really matter. And in this instance, children, young people and their families. We have resources that we can utilise to target certain groups, and in this instance we're looking at people who have fewer opportunities to get involved in research. So what we looked to do in order to develop a service improvement was we worked very closely with WIPAG to develop a children and young people's survey for people who are 11 to 18 years old, which then we developed, launched, and were supported to a huge extent by the network and by their introductions to the directors for education in region. And that's been running now for the past few months, and we will be closing it in July. On the screen at the moment, you can see the three main areas that we were focusing on. What do you know currently? What do you need to know to help you decide whether to get involved in health and care research? And how would you like to see that information presented to you? Also on screen at the moment is a QR code to the actual survey. So if anybody here is going back to an education setting and would be willing to share that, that's great. We can provide you with some resources in order to help you do that. Once we have closed it in July, we're going back to the WIPAG group, and I can see a couple of people from the group on the chat today. And WIPAG are going to actually support us to analyse and then disseminate that information out. So that's it with regard to the WIPAG CYP survey. And again, more than happy to talk to anybody offline if anybody has any further questions or queries. And that's me. So to the next slide, I think that's back to you, Steve.
Thanks, John. So I'll summarise things for a couple of minutes before we come to the end of the main presentation. I hope that the various speakers have been able to illustrate the wealth of support that's available for different aspects, whether or not you're interested in developing your own research, and the support that's available through our study support service to help you plan and deliver your studies, through to the support that's available from our direct delivery team to provide the hands-on support that might be required in your organisations to help deliver those studies, and access the support to ensure that you can recover the costs for delivering research. And finally, the links into the work that John has just described, that we make sure that we're listening and informing the work that we develop and take forward. And on this final slide are some of the areas that, as an organisation, we're looking to invest some of our resources and funding to take forward particular pieces of work. And we might talk about some of this in the question and answer session after the break. But just as a few ideas really in terms of the areas that we're looking to establish further work, we already have, as been described in some of the earlier presentations, links into our local authorities and schools. And we're looking to do some further work and establish research champions and research advocates. We're really keen to explore how we might work more closely with our other stakeholders across the health and care sector, whether that's in the voluntary and community sector, whether that's some of our other partners within the NIHR. As we've referenced many times, we will continue to invest in the engagement work with children and young people, and also think about how we can provide learning and development opportunities for those people working in education to become more confident in understanding how and where they can help to shape, deliver research, and make sure we provide opportunities to raise the profile of research as an opportunity for children and young people to take part in and to develop in careers as well. There's lots of jobs in helping deliver research as a career route as well. And then finally, part of what we're really striving to do is make sure that we help support the development and delivery of research that meets the needs of the people of the North East and North Cumbria, and particularly the children and young people, and meeting those health priority needs that we're all striving to meet. And referring right back to my earlier slide around how we do that by working closely together across the various bits of the systems in which we all contribute to. So on to my final slide, Jade, please. Which is a list of acknowledgements to thank all of those people that support the work that we do within the research network in the North East and North Cumbria. To Heather and the team within the Child Health and Wellbeing Network, who have been absolutely vital and critical in enabling us to undertake this work. So I really want to thank Heather for her patience and support over the last year or two with this work. A really big thank you to the education advisors, to Kate, Neil, Dave and Amelia, who've supported this work and really helped broaden our understanding of the needs of those working in education. It's been a massive eye-opener for some of us working in the health system to get those voices involved. Important, I think, to recognise those that have contributed to the survey and to the YPAG survey up to this point. And finally, most importantly, those people who've given their time to help support and take part in health and care research, those 7,000 children over the last 5 years who have taken part, the families who've supported them, and those working in those organisations that without their time and patience, we wouldn't have been able to deliver any of the work that we do. And thank you finally to everybody on the call for listening to us this afternoon, and really looking forward to hearing your thoughts and taking this work forward as we progress in the years ahead. Thank you, and I think back to Adele.
Thank you, Steve, and thank you to all colleagues who presented. Some really, really interesting things there to get us all thinking about over our coffee break. We might more need an iced coffee break, I think, this afternoon. But please just take this opportunity now. It's just coming up to 10 to 5. We're going to take an opportunity for just a quick 5 minutes comfort break, top up your glass of water, pop to the loo, whatever you need to do. And then after the break, we're going to come back and we've got a panel of colleagues, some of them who've spoken to us today, to really think about, you know, as settings, as organisations, how can we make best use of research, and how can we all get involved, and really to share those kind of reflections, queries, questions, and to put some of those to our panel. So quick 5 minute comfort break. If we see you all back on at 5 to 5. If you just want to turn cameras off and mics off, then it's easier to make sure we can get everyone back in the room on time and get started for our second half.
Thank you for calling number 0. Your call will be answered shortly. Please note, call will be recorded for training and
Okay, I think that's us all on 5 to 5. Hopefully we haven't lost too many people to the sunshine and the garden. So we're moving now into kind of the last half an hour of the session, where we're going to, as I said before the break, just do some reflections, any questions, queries, and just really want to introduce, if we can have the next slide, please, Jade. Okay, so these are the colleagues in our panel. So we've got Steve, who we already know, Kate, Alex, Rebecca, and John. So really what we're going to do is take some things. I know there's already been some posted in the chat, so we'll take some of the questions from the chat. If people want to put more questions in the chat as we go, then please feel free to. So I'm going to start in terms of a busy senior leader in a school, a lead across 2 schools, and I know we've got lots of colleagues from education on the call today, and what we're wanting to look at is how we can get more young people involved, get more education colleagues involved in this cross sector work. So I think really a couple of things that came up, which was a really good point in the chat, is about family engagement. So quite often as schools we'll get approached by lots and lots of different organisations wanting us to get involved in all sorts of different things, some linked with our priority, some maybe not entirely directly linked with priority. So thinking about, and this is to the panel really, how we can get that family engagement. So any hints and tips. So quite often we'll get letters into and agreements to get engaged in research, but then actually any hints and tips in terms of how we can engage families into the process. Whoever wants to take that.
Shall I take it, Adele?
Yeah, thank you, Kate.
Yeah. I think family engagement is such a key aspect, isn't it? Particularly in the school environment where you're at the heart of the community. And one of the things that we did as part of the survey was to say, what is it that schools want and what's going to be really useful to help drive the research. And one of the things that senior leaders said would be really important to them was about the way that research was communicated. So it was about the infographic that was being used. It was about the video that accompanied the research, because I think they felt that narrative was often too much for our families to take on board, or they didn't have the time, or the letters were lost. They wanted something that was, I suppose, quite 21st century. They wanted it to be snappy. And I think that came across from both sides. It came across from the school side, and also something that our families would want. So I think in terms of, thinking about family engagement, we know that if we've got, say, speech and language study, it's probably going to improve the child's speech and language ability, and that might help further with family engagement. But also we need those families to get on board. So it's about that inclusion aspect, and a lot of that came down to communication. So I think it is, hugely multifaceted, but if we get it right at the start and we get the engagement right, and there are activities there sometimes to accompany research which families can participate in, then our families will inevitably try and take ownership of that research too. So it doesn't just belong to the child, it belongs to the family unit.
Thank you, Kay. So, yeah, and I think that's really good in terms of thinking about that joint working in terms of the design of the research. So not only getting involved, but how we're going to get that engagement as well. Anyone else? Any other kind of hints and tips, Steve?
Yeah, I was just going to reflect on some of the learning that we've taken from the COVID-19 research that was delivered, some of the vaccine trials and the challenges and tribulations of trying to deliver studies of that nature with children and young people, which is part of what we did across the NIHR during the last couple of years. An engagement with families, children, and those working in the settings in which children spend most of their time was really an important thing for us to do. And there's a huge amount of learning, both locally and nationally, that we're looking to develop further in terms of the sort of research that we deliver and how we talk about research and how it's understood. So some of the more basic principles around what research is and breaking down some of those barriers and misconceptions, I think, really important, because there are some misunderstandings about what research is about. And I think if we can work with schools to help deliver those messages and share information and co-produce those materials with families and children to make sure that they are understandable and that they do come from a perspective that is meaningful, is what we will strive to do, and we are continuing to do that. So I think that's a really valuable aspect of the work that we'll continue to develop, and I think we'll be looking for volunteers and for people to step forward and help us shape that element of the work as we move forward, and we may be able to put some funding towards that aspect as we move on.
Thank you for that, Stephen. I think quite rightly identified, for some families, that idea of research, it's quite a scary thing, isn't it? Well, what is it we're going to be researching, getting involved in? And I think also there's maybe something, and I know colleagues have identified this through the chat, about asking our young people, as we are doing, how does it feel? How does it look? What's the best way to get our young people involved? I know a colleague in the chat mentioned about the possibility of research champions, and I think that's really, really key. If we have, some key people within organisations who are really championing this alongside our young people and our families, then I'm sure we can engage many more young people and families. In terms of sticking with that theme of engagement, there was something in the chat that came up around additional needs, accessibility. So this is something really, really close to my heart, working in the SEND sector, that we quite often get approached by organisations who want us to get involved in various different projects, and then we get so far down the line and actually it's not accessible. So anyone, any kind of thoughts around that accessibility?
I think one of the things that came up, Adele, when we surveyed all of the senior leaders, was about the vulnerabilities that were associated with the region. And we talked about all the different strands of work that the network does and facilitates. And mental health came up as a real vulnerability at the moment. And, you know, I think possibly because of the pandemic, but also because of the rise in SEND. So there was a huge number of people who responded back to the survey saying that they felt that they were the most significant areas that required further research. So I think it's something that's felt cross-sector. It came through with the special school results, it came through the mainstream school results and academy results. And I just think that we know what the vulnerabilities are. It's about trying to hone the research into those different aspects now. That's going to be really key moving forward.
Yeah. Okay, thank you, Kate. Apologies, I think I missed a hand up in the chat just before Kate spoke. And who have we got? Please, feel free to unmute yourself.
It's Dave McPardon here.
Hi, Dave. Welcome.
I was just thinking, sort of, I think from a school's perspective, I think it's really important that it's seen as a long-term objective, because I think it's about in terms of trying to engage young people and families. It's about sort of building those relationships. And I think one of the problems is somebody comes along with funding and says, oh, want to do this. And we then sort of try and contact families. And then there's almost too much learning to be done in the time scale. And therefore, I think one of the things which has got to be taken into consideration is that just the time aspect of this. It's really time consuming in trying to build and develop those relationships. And that was just a thought, really, not a solution, but a thought.
And maybe that comes back, thank you, Dave, maybe that comes back to this idea around those research champions in organisations. So actually they can support with that and understand that time commitment and that engagement that's needed. Okay, thank you. I can see a couple of other things coming through the chat. Paula talked about, and I know this came up as a theme earlier on, is that aspect of that closing that feedback loop so that families understand once they're engaging with research, actually what difference is that going to make, and what's happened following on from that. Steve, you've got your hand up.
Yeah, and I think that's something that we hear on a regular basis across all of the research that we deliver, and I think we need to recognise that there is a significant amount of work required in that area in terms of research being delivered, and then there is a significant time delay often between when research is conducted and reports are then shared, and often shared in peer-reviewed journals that limited people have access to, and understanding of how to access quite detailed information. And I think there is a significant piece of work that both at a local and national level that's still required in terms of the feedback loop, how we share the findings in a meaningful way, and ultimately how we implement findings where we find a positive outcome from the research that we deliver, and working with the other parts of the National Institute for Health and Care Research system that have a remit to support how we enact and implement research findings in practice, whether that's in health or care settings or whatever perspective that comes from. And that is something that we are tasked with improving as an organisation, and something we will at a local level need to consider. And I think in terms of the point that Dave raised, we know that we can sometimes throw money at some of these challenges for short periods of time that kind of start off a piece of work but never really have a longer term establishment behind them. And I think that's what another area that as an organisation we would be looking to work on as we move forward, is setting out some longer term goals and understanding investments that can have a real impact, particularly as we know how busy people are. So small amounts of money for people's time doesn't often have the impact that we, from an external perspective, would think it might. So we need to think slightly differently and understand the ways in which those working in education might benefit, whether that's funding, time, working through the local authorities to look at the posts that we might be able to fund when we join pots of money together and have more substantial posts with a particular remit. So we can think creatively about that, and that's really what I'm keen that we start to open those conversations up in the months and years ahead.
Thank you, Stephen. I think lots of really good points there, linking back to what Kate was saying in terms of initially get people involved in research. The idea of having a simple infographic, and actually probably the same at the other end when research findings are published. As you say, they sometimes go into journals which aren't always accessible, and how do we get that message back to families and young people that actually your involvement in this research has had such a difference and an impact, and how we share that. Meg's put a really good point, and I think this is something that we all have that kind of moral, social responsibility to, in terms of our young people and their families. You know, and Mike said we need to research explained and introduced to children at grassroots level, and it becomes second nature. So it's not just about researchers contacting schools when they want something, but actually that whole ethos of that curiosity. We talk a lot in education about professional curiosity and understanding that professional curiosity, that it does just become second nature. And I suppose, any thoughts really in terms of how we get to that point where we have families and young people who have that curiosity and understand what research is. As we said before, it can be a big scary word, research. Oh, what does that mean? But it's progressing things that are going to impact our young people. Anyone have it? Thank you, Meg. I think that was really, really pertinent. Anyone, any thoughts around that? Go on, Steve.
Yeah, I'll go again. Just off the top of my head, I know, and I'm aware of a piece of work that's been developed elsewhere in the country that's looked at developing some materials to be delivered as part of the curriculum around health and care research. I'm not quite sure where that might sit on the curriculum necessarily, but there are materials being developed that we can access, and we may look to trial some of that, pilot some of that work with schools locally in the time ahead, and we've got the resources and the time of which to do that. So I think starting small and understanding how and where that might fit in what's obviously already a very busy timetable and curriculum to fit lots in. So I think there are opportunities, there are schools nationally that are looking at this, and there are materials that have been developed appropriate to various a range of ages as well. So I think having to think about where and when is the most appropriate time and what the kind of content might be. I think there's work we can do and help facilitate in that area, and there's some really good examples, as I've said, that we can share and talk to people about if they're interested in doing some of that work.
That'd be great. Thank you very much. I'm sorry, Kate.
I was just going to say that the only other thing that I would add is about children understanding the roles within, say, NHS and beyond. And I know the Integrated Care Board in the North, I think, sent out some mini scrubs to all of the primary schools, and that was a fantastic way of children being able to understand what the different roles and responsibilities were across the NHS sector. So we had some mini scrubs for researchers, mini scrubs for radiographers. And it was about the children understanding the context of how research fits into the wider culture. And because of that, that's kind of like it's drip feeding all the way through about how their involvement can make a difference long term. They might not necessarily see the fruits of the creation, but the aspiration, the curriculum, the relationships and health education work that we do within schools, it's all linked together to ultimately improve their life experience. It's just about communicating that to them, but over that long period of time, and as Steve's hinted at, appropriate to their age and stage of development.
And absolutely, that empowering, isn't it? Empowering our young people. And Dave's put in the chat there around developing that culture, which is I think what you're saying as well, Kate, in terms of that drip feed, so it doesn't become there's this scary researcher wanting us to get involved in some research. It's actually, we need to have our voice heard. I know we have lots of different young people involved in different groups, and it's so powerful when they hear that their voice is heard, and when they hear other organisations, and really I think one of the big things through working with young people is they just have such a different perspective that we do as adults. We think we understand young people's thought processes, but they can give such golden nuggets of thoughts and reflections that actually would probably never have crossed our minds as adults, because we're just in that completely different headspace. So yeah, absolutely about empowering our young people, developing that culture in schools to be able to have their voice heard and understand the changes they're making as part of, you know, that wider societal impact that they can have from whatever age that is. You know, it doesn't have to be from teenagers, it can be primary age, or through to young adults as well. Okay, thank you everyone. I'm just looking through my list. I think we've covered kind of most of those things. Any kind of final thoughts from our discussion panels, colleagues, in terms of this topic? Any pleas maybe? I know we've got lots of education colleagues on the line. Any pleas to colleagues in education of how we can support the work that you're doing and ultimately support our young people and families to become more involved? Steve?
Yeah, I think the key message, as we've talked throughout, is around communication. So please get in touch with any question, no matter how daft that might seem. Please just get in touch, and we'll direct you to the right people that will be able to provide you with the correct advice. And we will be outlining our plans for the next stage of the development of the work based on the recommendations of the survey, and we're hoping that we'll have some funding to help support some of those pieces of work. So we will circulate the information as and when that is available, but there will certainly be numerous opportunities to continue engaging and working with the research network in the months ahead. And I really look forward to hearing from people that have been on the call today, and I guess some of those people that might listen to this back on another occasion as well. So thank you everybody for listening. Thanks, Adele, it's been really helpful. Thank you.
Thank you, Stephen, to all panel members. Lots and lots of food for thought there in terms of how we can get involved, how we can empower our young people and our families, and how that we can make research just something that's natural to get involved in. So I'm going to hand over now to Amelia. Amelia is our Network Development Manager. For those of you who are not part of the network, Amelia is just going to take us through some of the things that are coming up in our network. We've got lots and lots of really exciting projects on the horizon or ongoing at the moment. Some of you who are already part of the network may be familiar with some of these things that are happening, but please do, I know Heather put a piece in the chat to start with. Please do tweet about the event. You know, do get in touch, get colleagues signed up to the network. Such a vibrant network of lots of different cross-sector organisations getting together for the benefit of our young people. So thank you, and over to Amelia.
Thank you very much, Adele. Sorry about that. My connection's a bit slow. So if I could have the first slide, please, Jade. So yeah, so the first big announcement, I guess, of work that we've got going on at the moment is the Chris Drinkwater Creative Health in Primary Schools Award. And this is applications from primary schools who are involved with creative health activities within their school, and it's in honour of a really well-loved and much respected former arts and creativity lead within the network. The schools need to be within the northeastern North Cumbria, and they need to be promoting creative health benefits in any form of the arts. And it's all about partnerships between schools and arts and organisations, and how to address social and emotional learning to improve health and educational outcomes. So please do get in touch with us, and we'll pop the link in the chat as well for people to sign up and get involved with that opportunity. So the next slide. And this is a piece of work that we've been that I've been working on for the past year, and this is our Sustainable Child Health resource. So on our Healthier Together website, we have a page which is dedicated to sustainable healthcare, and it's all around sustainable child health. So it looks at there's 9 different PDFs. They're all interactive. They contain lots of different video clips, website links, articles, journal articles, and it really sort of breaks down and looks at sort of what's happening in the world. Why do we need to think about children's health and well-being, and the impact that the climate's having on a number of different areas. And it's not just looking at health, it's not just aimed at people working in health, sorry, it's people working in any area. So at the end, the final chapter is all about different professions, and there's different pages dedicated, or different slides dedicated to different areas of work, with opportunities to get involved with making a difference and how to apply some of the sort of learning in the course to your area of work. But highly recommend having a look and downloading the PDFs, watching some of the video clips, and it's something that you can dip in and out of over the summer, and it's free to access. And as part of that, there'll be 2 workshops, one's in July and one's in September. So if you wanted to talk further over any of the issues raised, or you wanted to develop a project in your area, you're very, very welcome to join those workshops, and the sign up is on the Healthier Together page. Next slide, please. And I've already mentioned Healthier Together, but not sort of explained a bit about what it is. Healthier Together is a fantastic website that has been created by professionals in child health, and it's a fantastic resource. So if you have a poorly child, you can access the website and pick up. So when there was a child in the class WhatsApp group who had chicken pox, and everyone's trying to work out, well, when can they come back to school? We just sent over the page of, is my child well enough to go to school? It is an amazing resource. It's there for professionals, it's there for families, and it's available as a website and also as an app that you can download to your phone as well. So it's if anyone wants more information on that, they can get in touch with us. We can put you in touch with our colleague Laura, who leads on that project. Next slide, please. So yes, this is Louisa's Beat Asthma Friendly Schools accreditation, and it is a multi-agency piece of work that's involving schools from across the region, and it's all about improving education around asthma and supporting schools to look after the children and young people in their school, and supporting staff as well, because it's really, really important that staff are supported to know more about asthma. Melva has been involved, which is an incentive around children's health and well-being. It's a lovely video clip, video package, and that's produced by an organisation called Mortal Fools. And there's ongoing work to roll it out within secondary schools, and also the Asthma Friendly Sports Club, which is really, really exciting and so important, especially at the moment. So next slide, please, Jade. So as ever, Child Health Tuesday has come out this afternoon, and that's our colleague Jen, who leads on our comms around our newsletter, Child Health Tuesday bulletin. So we've got around 1,700 members. So if you ever had something that you'd like to feature in there, please get in touch. Please let us know. If you have information about research that you want sharing, please let us know. And if you send it to our main inbox, it will reach Jen. We've got our Every Child NENC account with over 1,600 followers. And then we've got opportunity to be involved with our governance and our system engagement group, who meet bi-monthly to support our reach across the system. I think this is Huddle number 18. I'm not 100% sure, but I think it is Huddle 18. So we've got quite a big programme of different events that we've had. The next one, which is on the 6th of July, 10 till 12, is our Core 20+5 piece of work. So that's looking at inequalities for children and young people. So please do register and get in touch if you would like to be part of that. And the registration links just come out on Child's Health Tuesday. We've got loads of different reports and resources, including our Facts of Life, which Louise referred to earlier, the Inequalities Project Showcase, all the TRIPT work, which is around the respiratory illnesses, as well as comms toolkits. So if anyone wants any further information on any of the topics covered, please, again, get in touch with our main inbox. And again, Healthier Together. We've got a Facebook page and a Twitter account, and there's been lots of activity on there with really helpful information. There was a post that came out just before that was all about coping with the heat and looking after your child in extreme heat. So that is really relevant. So please do have a look at those. Next slide, please, Jade. Got our newsletter, so if you'd like to have a look at that. I know Jen's in the process of finalising our summer newsletter, so that'll be available within the next couple of weeks. Next slide, please, Jade. And this is just an opportunity to get involved, so please do get in touch. And all these, after this event, we'll send out the slide deck so that you'll be able to click on all of the links. And it'd be great to have more members if you're not already, but I think everyone here is a member. So thank you very much. We have the next slide. I'll just pass back to Adele. Thank you very much.
Thank you, Amelia, and thank you to everyone who's joined us this evening. I think some really interesting food for thought in terms of research in schools and how we can get young people, their families and the wider society involved in more research, particularly where there's going to be that impact on outcomes for our young people. So thank you very much. As Amelia said, lots and lots of opportunities through the network. I think one of the things that I really value from the network is that cross-sector working. I'm sure in schools we tend to work in schools, and yes, we meet colleagues from other sectors, but really key in terms of this network that there's lots of opportunity for collaboration, as we've heard from Steve and the team today, in terms of the work that they're doing. And as Amelia said, we've had over 18 huddles. I love the word huddle. It's not a word we use particularly so in education. And I said, oh, is it like a warm cuddle, or what's it like? This huddle idea. So thank you very much to everyone who has presented today, who has attended today. Please do sign up, share with colleagues. There's lots of information in the chat. I know there was a couple of other links to surveys and participation questionnaires. So please do have a look back at the chat, and thank you very much, everyone. And just the last slide, I think Amelia's already covered. If we can just have the last slide, Jade. Thank you. So a couple of other links there. We're bombarding you with links, but I think really important that you've got all of the information. And thank you very much. We look forward to seeing you again on one of our next huddles. Thank you, everyone. Have a great evening and enjoy the sunshine. Well, yep.
All right.
See you later. Thanks.
Yeah, thank you, everyone.
See you. Bye.
Okay. All right, Amelia. I think she might have gone. All right, Jade. Thanks for sorting all that out.
Delicious.
Come in. Hey. All right. Went okay? Don't know, she's obviously having IT issues. All hell is about to break loose, by the way. Joanna's just arrived home. Oh, she's gone. Anyway, well done, Jade. All sorted.
No
That was
worries.
okay. That was a
Yeah.
slick time. We
Yeah,
had loads of
that's
time,
good.
didn't we? I
Yeah.
was like worried because I was supposed to have had 5 minutes, and then I
Mhm.
looked at the thing and I was on 7 minutes, and I was like, oh God. But anyway, it's okay. We're all
No,
all
that's
right, aren't
good.
we?
Yeah, all good.
Fab. Okay, right.
Right.
Thanks very much.
Speak
So
to you
I'm not
soon.
around tomorrow. Well, I won't
All
see
right.
you now till Saturday.
Yes, see you on
So
Saturday.
I hope you have a lovely day in the
Thank-
morning.
Yeah,
And
thank you.
just, you know, enjoy. Take
Yeah.
every minute.
Yeah, great. I'll
Okay.
see you on Saturday night
Yeah, I know.
then.
See you
Bye.
later. Bye. Bye.